Okay, I'm Mbabazi. I work with the National Population Council as a Senior National Program Officer in the Policy and Planning Department. My interest in this subject is tying with what Judith has just presented, moving on to the demographic dividend. As she has said that the demographic dividend includes improving the changing structure. And some of the drivers for improving that population structure is fertility. And our tying up in this subject, we are looking at adolescent pregnancy as one of the drivers of fertility, which consequently affects the demographic transition, which is a process for, or a prerequisite for harnessing the demographic dividend. So this study is a joint effort of some of the authors. We have David Canning, we have Iqbal, these are professors at Harvard University. We have Alex Kintu, John Bosco Asimwe, and John Sekamati from Makerere University. In this study, we look at the presentation, we give you the overview, the objectives, methods, key findings, and of course conclusion. And in our introduction, we note that adolescent health is a global concern, mainly of its consequences to maternal and child health. But for us from the population sector, we are more interested in the consequences of the adolescent fertility's contribution to the overall national fertility as it influences the demographic transition, which is a prerequisite for harnessing the demographic dividend. And we note that in sub-Saharan Africa, we are still lagging behind in terms of fertility control, which is a key factor if we are talking about the harnessing of the demographic dividend. For the demographic dividend to happen, we must see a change in fertility coupled with a change in mortality. And for our case, we note that adolescent births have remained constant for the last 10 years, at 25%, where we have about 1 in every 4 girls being pregnant in Uganda. And this rate only declined from 31 in 2000 to 25 in 2006. And since then, it has remained stable. So for our purpose in this study was really to find out what are the factors that have contributed to that stagnation in the decline of adolescent pregnancy in Uganda. Further, our objectives is really to look at the trends, but as I mentioned, to really find out what are those factors, the major factors that are driving the adolescent pregnancy stall in Uganda for that period, at least now for a decade, for about a period of 10 years. In our study, we adopted a model that is a conceptual framework for early adolescence. That is by a platform for research by Bloom and others. And in this model, we look at the independent factors, majorly the age, education, wealth index, place of residence, and region. We look at the proximate factors, mainly the age at first sex and age at marriage, and their influence on the overall adolescent pregnancy. Now, if you look here, we have mainly maintained age for control purposes, but as we later discuss, you'll see that most of the factors, really the drivers are around education and wealth as well as region. Now, in our study, we also hypothesized that adolescent pregnancy is associated with a sexual debut and marriage. We also look at poorer and low education background as more likely to influence adolescent pregnancy, but also we claim that the stalled pregnancy is attributable to the changes in those trends of sexual debut and child marriages. We further note that in our sample, we include girls who are 15 to 19 years extracted from the individual record file within the DHS of women 1549, giving us a total sample of about 9,937 adolescent girls. We used the logistic regression and further the decomposition model to establish the major factors that accounted for the stall of adolescent pregnancy. Now, in the subsequent slides here, I try to give out a few of the descriptive statistics for the interest of time. We note that the mean years of education in Uganda mean years of education for girls 15 to 19, we note that it has been on the increase. But most importantly, most of the girls in this sample did not complete the expected 7 years of the first level of schooling. Most of them are around 6.1, around this level. That is the key factor or one of the drivers of the adolescent fertility. We further note that the girls who have ever had sex, it reduced from about 42. It reduced to about this level, if you can see, I'm not able to see without my specs. To this level. And then steadily continued increasing in the subsequent years. We also note that for the girls who have ever been married, there was a significant decline from 2001 to 2006, and then in the subsequent years, it's sort of like stabilized. So we can already predict that we haven't had a significant change in the girls completing primary 7. Most of them are engaging in sex when they are very early, but also they are getting married very early. Well, we note that there was a significant drop in 2000 and 2006, but these factors have all remained almost the same, which can quickly give us maybe the expected picture of what is driving the adolescent fertility in Uganda. And also we note that even if there has been significant improvement in household wealth, this hasn't been really much enough to improve the situation of girls' education attainment, as we'll later see in the subsequent discussions. So having looked at those brief prescriptive statistics, we now go into the actual determinants of adolescent pregnancy. As I highlighted in the model, we looked at both proximate and the independent or the socioeconomic factors. Among the proximate or the direct factors that influencing fertility, adolescent fertility, we see that child marriage and engagement in early sex are the major drivers. We see that the girls who had ever been married were almost 13 times higher likely to get pregnant compared to those who were not married. And we see that younger adolescents, those who are below 15 years of age, were almost 2 times more likely to be pregnant compared to the older adolescents who were 15 to 19 years old. This is the basic message here. We are seeing that the major drivers of adolescent pregnancy and that has contributed to the stall is mainly child marriage and engagement in early sex. Then among the socioeconomic factors, we note that education is a big factor. We see much reduced likelihood of being pregnant among girls who have attained higher level of education, like secondary level and higher, compared to those who are at the lower levels of education, telling us that the more the the longer the girls stay in school, the reduced likelihood of being pregnant. But we also note that girls from wealthier quintiles were less likely to be pregnant compared to those which are rich or poorer wealth quintiles. And further still, we note that girls from the western region were less likely to be pregnant compared to the other regions, and maybe this could be attributable to some cultural beliefs and traditions within those regional settings. Moving further, we did a further analysis, a decomposition, to really confirm the findings of the logistic regression. We further noted that even with the further decomposition, to really explain the noticeable change between 2000 and 2001, we note that, again, age at first sex and marriage, coupled with improvement in education, were the main drivers of that decline of 31 to 25, 31 in 2000 to 25 in 2006. And we note that after 2006, as we saw in the earlier graph, we don't see a significant change in either age at marriage, early sexual debut, also within the years of schooling. So we conclude by noting that the early initiation into sex is associated with adolescent pregnancy in Uganda, but we also note that the girls who come from low and poorest backgrounds have a high risk of being pregnant. We further note that indeed the decline between 2000 and 2006 is really attributable to those factors, and the major story here is that if we really have to invest in keeping the girls in school, but in addition maybe enroll those who are sexually engaged into family planning or other means like accelerated education program as a means of controlling their fertility. And in terms of implications for UHC, we note that lowering adolescent pregnancy is central to improving the maternal health outcomes and specifically child survival, which is a driver of fertility in terms of increasing the confidence of women to trust that the fewer girls or children that they have will be able to survive as a measure of controlling fertility. We also note that the relevant UHC policies should focus on including at least some of these key services, especially in the packages as they proposed the national health insurance, that at least there will be maybe an affirmative action to have subsidized services, especially addressing the adolescent sexual reproductive health needs, but also calling for multi-sectoral action in terms of keeping the girls longer in school, as it has an effect in terms of increasing the age at sexual debut, increasing the age at marriage, which in turn influence the age at first birth, which has a direct consequence on fertility. Briefly, that's what I had to present to you. And this study, we acknowledge again the School of Public Health at Harvard, the National Population Council, UNFPA, and Makerere University through the SPEED project that has facilitated these engagements. Thank you very much as we continue to empower the young girls for accelerated transformation. Thank you.
Thank you.